Good afternoon, everyone. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we face problems in the healthcare system and then try and take actions to make a better system for all of us. Before we get started discussing both cardiac arrest and Alzheimer's, I want to point out that down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for this video. All of the references to studies and news articles and background material and actions, it's all in that newsletter, and you can subscribe for free once you open it up. Okay, so let's get started. I want to talk first about some recent advances regarding Alzheimer's. The first one has to do with a medication called Kisunla, Kisunla. A new drug has just been approved by the FDA to treat Alzheimer's. It's called Kisunla. It has been shown to significantly slow the progression of Alzheimer's. It doesn't cure it. After 18 months, patients that were treated with Kisunla showed a significant 35% reduction in clinical decline. That's things like memory, thinking, daily functioning, compared to a placebo group. It is pricey. It costs about $32,000 a year. Now, if you have Medicare, you should check with them, especially if you have Part D, the drug plan, and see if it covers it. I have heard tell that it should, but you check before you buy this. Okay, the next one has to do with a study that was done in Japan regarding Alzheimer's and dopamine. A hormone that's best known for its role in pleasure and reward might hold a key to fighting Alzheimer's. Researchers at the Riken Center for Brain Science in Japan have found that dopamine stimulates the production of an enzyme capable of breaking down beta amyloid plaques, which is a hallmark of Alzheimer's. The study was published in Science Signaling. It used a mouse model to demonstrate how dopamine increased levels of the enzyme neprilysin. Forgive me. Anyway, let me point out that the actual study in Science Signaling is actually in the newsletter. You can just go click on that link. This actually led to a reduction in beta amyloid plaques and wound up improving memory function in mice. Now, the lead author, Naoto Wadamura, and his team employed a really novel approach, inserting designer receptors into dopamine-producing neurons in the mouse brains. When activated, these neurons boosted neprilysin production and decreased free-floating beta amyloid, which is really cool. The researchers then applied this method to mice that had been genetically engineered to develop Alzheimer's-like plaques. After 2 months of treatment, the amount of beta amyloid plaques in their brains noticeably decreased. Now, a final experiment, the team used L-DOPA, which is a dopamine precursor, used to treat Parkinson's disease. Mice treated with the L-DOPA for 3 months showed an increase in neprilysin and decreased plaques and improved performance on memory tests. A cure? No, not yet, but this is really promising stuff. Now, to learn more about this innovative research and its implications for Alzheimer's, I have a link to an article called Dopamine Treatment Destroys Beta Amyloid Plaques in Mouse Model. If you're interested, go there and read it. Let's talk really briefly about SARS-CoV-19. It is officially endemic in the U.S. 4 years after the SARS-CoV-2 pandemic sparked a devastating global outreach and destroyed millions of lives, U.S. health officials now consider it endemic. At this point, it is described as endemic actually throughout the world. My error. Aaron Hall, the Deputy Director for Science at the CDC's Coronavirus and Other Respiratory Viruses Division, told National Public Radio in an interview this week. That means essentially that COVID is here to stay, but in very predictable ways. The classification doesn't change any official recommendations or guidelines for how people should respond to the virus, like wear a mask and make sure you get vaccinated. Anyway, the link to the NPR article is in the newsletter, and my comment to you, get vaccinated and wear a mask. Okay, let's talk about CPR. When a person's heart stops, their odds of survival are greater if a bystander immediately performs cardiopulmonary resuscitation, CPR. Now, USA Today ran a story recently on CPR. It involved a recent study of CPR survival when cardiac arrest occurs outside the hospital. They found that Black people and women in general were less likely to survive after CPR for cardiac arrest. The study uncovered dramatic differences in outcomes based on race and sex of the people who went into cardiac arrest outside the hospital and received CPR from someone who was not a first responder, like a trained paramedic. They found that white people were 3 times more likely than Black people to survive the episode, and men of any background were twice as likely to survive as women. The findings were published this week in the American Heart Association journal Circulation, and of course there's a link to it in the newsletter. Prior research has shown bystanders are less likely to perform CPR on Black and Latino people. However, the researchers found that even when Black and Latino people received CPR from a bystander, their odds of surviving were considerably lower. So there's some sort of a cultural thing going on there, which we don't have a handle on. The study, which received funding from the National Institute of Health, drew data collected from more than 623,000 people who had cardiac arrest outside the hospital between 2013 and 2022. 58,100 people in that group survived. That's 9%. When cardiac arrest occurs, there is a clear link between well-administered CPR and survival. There may be cultural issues regarding administering CPR, regarding non-white and non-male populations. It's good that we know that, but there's something else. Let's take a step backwards for a moment. In this large study of 623,000 people who had cardiac arrest outside the hospital, 9% survived when CPR was administered by an average person. Some of those people who were applying CPR may not have been well trained, and maybe were trying to follow the directions of a 911 operator. Some may not be up to date on whatever training they've had in the past. So what can be done to improve the survival rate? After all, 620,000 people with cardiac arrest and 564,900 died. Not good. First, we should all make sure we've been trained to administer CPR correctly. The Red Cross has classes. You can find classes online. They are minimally expensive. I saw numbers like $10 and $13. I have a link in the newsletter to the Red Cross, and they'll help you find a class. It takes about 3 hours. It's easy to be trained, 3 hours and done. Now, here's an idea. What if every high school student were trained in CPR? If more of us knew CPR, more lives could be saved because you'd have people everywhere that knew how to administer it. 3 hours in a high school career is not a lot to ask. So let's ask. Let's take an action to call or email our governors, our state senators, and state representatives. Ask them to submit legislation requiring CPR training, maybe for high school graduation. If more of us knew how to do it correctly, we could save more lives. I have a link which I will put into the YouTube description box so you can call or email them, or my favorite, use ResistBot on your cell phone. All you have to do is send a text message to 50409. Here's the message. Sign, S-I-G-N, space, P-N-D-M-E-M. That's sign, S-I-G-N, space, P-N-D-M-E-M. And here's the message you're going to send. I'm your constituent, and I want you to know that in a recent study of 623,000 cardiac arrest victims, only 9% were able to survive. Their hearts stopped outside of a hospital, CPR administered by a non-professional. We need to make sure that we all know and can deliver CPR effectively. CPR training takes about 3 hours. If every high school student were trained, hundreds of thousands of lives could be saved. I want you, my representatives, to bring forward legislation that includes CPR training in high school. You can even make it a graduation requirement. It's really a small thing, and it'll mean so much to so many people. Thank you. And I know your legislative analyst wants to look at this, so I included the link in the email for them to review that article in the American Heart Association journals. That's what I've got for you today. Down below, you can like, share, subscribe, send me comments. I try to answer them all. You can also send me comments at healthcareadvocacy1, all one word, @gmail.com. That's it. Have a good evening.